evaluate it.
Now, in a case like this, I mean, these look like very severe cases. Can a foot be saved?
Indeed it can, and it is important to revascularize, meaning to increase the flow, augment the flow back to the tissue. Now there may be some loss of tissue that has already died, but what we're talking about is salvaging the foot or the lower extremity, and indeed it can be by increasing blood flow, and there are various methods of doing that.
So doctor, how does a physician make a diagnosis of PAD? How is that done?
Well, initially it's the history. The patient presents with symptoms that sound like it's peripheral arterial disease. And then by doing the examination, and on the examination there will be signs of the disease, and then you move on to ancillary testing, and the most simplest is called the Doppler ultrasound. It's a probe that's placed on the leg, and it just checks the flow through the extremity and gives you a kind of rough estimate. Is it normal, slightly decreased, or significantly decreased? But does not tell you specifically where it is at.
Well, it sounds more complex than what it is, right?
Yes, it is, but it's a disease process that takes years for it to develop sometimes.
Wow. So for those of you who are just joining us, we have with us today Dr. Frank DiMaria from the Hyperbaric Wound Care Center of Advocate, Illinois Masonic Hospital. And our lines are open for questions. Numbers at the bottom of your screen at area code 312-738-1060. If you have any questions for Dr. DiMaria or our next guest, Dr. Serena Satcher, please give us a call. Lines are open. So doctor, many people with PAD have no symptoms or mistake them. We talked a little bit about that earlier. But I think for me it's really important to reiterate what these symptoms may be.
Well, the most common symptom is fatigue and difficulty maintaining your normal physical activity. And then it's followed by, as it worsens, by pain with exercise. The pain could be diffuse throughout the lower leg, throughout the entire lower extremity, and usually is relieved with rest. And then the next phase, when it worsens even further, is that you're awakened in the middle of the night with leg pain. It just won't go away. You get up, you walk, and then it finally goes away as walking increases the flow to that extremity and relieves the ischemic changes by the lack of flow while you were in the supine position.
Well, doctor, there's one other picture here I actually want to talk a little bit about too, if I may.
Sure.
Let me just bring this over here so we can talk a little bit about this. But before we do that, we do have a caller. Caller, you're on the air.
Hi. Yes, I had a quick question. I was just wondering if accidental injuries to the extremities that may be healing or not healing properly, some kind of indication of some kind of PAD type scenarios going on.
Well, doctor will answer that for you, okay?
Alrighty,
thank you.
That's
Doctor?
actually an excellent question.
Great question.
The body is a wonderful machine, and it can function marginally without exhibiting too much disease at times. So yes, you could injure yourself and you have marginal flow, meaning that not enough to heal, but enough to maintain, so that you've injured yourself and now the reparative process cannot take place because there is not enough flow to that area, and indeed that could be a direct manifestation of peripheral arterial disease. There are many other potential causes, but certainly PAD is a possibility.
Well, Dr. DiMaria, I really appreciate you coming today and discussing this, and I know we're going to continue the conversation in just a little bit. But for those of you who are tuning in and have any questions or would like more information on the hyperbaric and wound care resources with Dr. Frank R. DiMaria of Advocate, Illinois Masonic Medical Center, you can reach him at 773-296-8360. Again, that's the hyperbaric wound care resources at Advocate, Illinois Masonic Hospital, where I know we have a wonderful, wonderful treatment center there on hyperbaric care. So coming back to us, Dr. Serena Satcher, thank you for coming and being on the show today.
Thank you.
And I know we're going to continue with this conversation, and I know this just, I mean, we can go on and talk about all these things, and there's other pictures here that I want to share just to give our viewers an idea as to what this looks like and how bad it can get, and most amazingly, the fact that your foot and or leg can be saved. So with that, Dr. Satcher, again, thank you for coming on board. Someone's leg can be saved if an individual has PAD, as we're discussing right now. But what if that wound becomes gangrenous? I mean, can it still be saved? I mean, what does that entail? Do you mind if we show this picture here? Is this one of the ones we want to cover?
Show the picture.
Wow, that looks really serious.
Yeah, that's gangrene that's set in the heel. And it set in there because there was not adequate circulation in that part of the foot. And what we do is we call it limb salvage. We try to save as much of the limb as possible. And it's usually a joint effort between the primary care doctor, surgeons, the vascular surgeons, also the wound care doctors. Probably if it's a diabetic patient, the endocrinologist would also be a part of that team, the nurses, because it takes a great effort. Not only would that patient have to have probably a surgical procedure to remove the dead tissue, but they would also have to have a procedure to, evaluate the circulation. Dr. DiMaria talked about when you get an 80% blockage in the artery, or if you get an embolus or a clot in the artery, that artery either has to be opened up or the clot has to be removed, or they may have to have vascular surgery to have like a bypass operation in order to reestablish circulation in the lower extremity. And with the wound care, they are going to need to have advanced wound care like we offer at Illinois Masonic, that includes hyperbaric oxygen therapy, advanced wound care methods that include ointments and creams that we use on the wounds, also advanced dressings.
I can speak from firsthand with the wound center. Unfortunately, my mom, may she rest in peace, but I know that with her care there, I was, and one of our other providers there, Dr. Alameda, her podiatrist, and in working in partnerships with you and your team, they actually saved her leg from being amputated from a diabetic ulcer that turned and changed, and the infection, and it was from one day to the other. That's how quickly it came. But I can speak firsthand on the services that were there. But going on that, we do have a caller. So caller, you're on the air.
Okay.
Please call back.